Morning, everyone. I'm Mary Johnston. I'm a nurse that works in Chicago for the Advanced IVF Institute and Advanced Gynecologic Surgery Institute. I work for a group of physicians. We do minimally invasive gynecology. I've worked there for 30 years, and I am an RNFA and as well as a CNOR. And we are here today to discuss hysteroscopic fluid management systems.
Okay, my name is Clover Kemp, and I work at a Johns Hopkins hospital in Washington, D.C., Sibley Memorial Hospital. I work in the main OR as an operating room nurse.
Hi, I'm Ashley Reynolds. I work downtown Indianapolis, IU Health Methodist. I work in their general surgery as a charge nurse and then also circulate their GYN cases frequently.
My name is Andrea Fox. I work in Indianapolis as well. I work at Community Health Network in a surgery center on the south side of Indianapolis.
My name is Barbara Friscia. I'm from Women's Hospital in Baton Rouge. We are a women's facility. We do all female procedures. We do the myomectomies with the taking out the uterine fibroids. We use a piece of equipment for that, or they can do it with a manual instrument. We also do DNCs with the hysteroscopes sometimes, just cancer-related procedures that would warrant them to look, postmenopausal bleeding.
So why do you think fluid management is so important for the patient?
You can't introduce so many fluids into that area without having some effect on the patient. So that's a monitoring feature with the fluid management system we use.
Right. Have you ever had a time where you felt good about a patient's outcome because of the pump and the hysteroscopic management of fluid that you personally managed?
We just recently had, deficit of like 150, so we were all really excited about that.
Right. You find it a personal challenge to get under 1,000.
Yeah.
Right.
Yeah.
Or no fluid on the floor.
Yeah.
Before the fluid management system, it was just a pressure bag.
Most part we use hologic, but for regular hysteroscopies where they don't envision using a myosure, we will use the pressure bag that we've got to pump up.
And what is the challenge with that?
That was, you better get your muscles in gear, girl, because you are lifting, and that is where you have to have a fluid nurse. You have to have the suction canister nurse. You have to have, you have to watch, because someone has to slip those bags.
Would you prefer to use, do you prefer to use a fluid management system when you can? Of course.
Yes.
Yeah, it's easier, right?
It is so much easier.
Right, I agree totally. I remember those days of the fluid with pressure bags and everything. How did you feel the learning curve was to learn it? Do you feel comfortable with it now?
I feel comfortable with it now, and we have the same team that does these cases, so they became pretty familiar with it quickly. And people who don't do it as often, we have like sheets on top of it to help out with them. So
we've got the same rep that goes to both of our hospitals, and she was great in teaching anyone who was in there. Whether we have a lot of students that come through, Methodist, and just anyone that's in the room, kind of telling them how it works, and just making it really easy to learn. And we've also got the little guide on top.
We have a super user.
Oh, that's good.
We have a super user, and it's that one of the nurses we have in our department has used it. She went to most of the classes. She's worked closely with the sales reps. She really studied the manuals and is very proficient at it. So if anybody gets stuck or has a question to troubleshoot and the rep is not there, we always call her, and we call her our technology super user for the fluid management system. Wouldn't it be nice if instead of me still having to go to that old 1,000 cc pressure bag and this, the cysto tubing, and then another tubing that came off of the other side to go into the bag, and to have a smaller scaled fluid management for those small cases. They did it with they've done it with other pieces of equipment. Could I have a smaller piece of equipment that would handle just those 1,000 cc bag cases? That's just an diagnostic and not an operative.
What are some complicating factors that you see with the hysteroscopic systems that you currently are using? Things that are maybe the canisters, the canisters overflowing. Is there anything that you find that's really challenging with the current systems that you're using?
I mean, I've had situations where they have perforated or there was an absorption and we had to stop.
I think with the we use the underbuttock strape to try and catch what's coming out of back out of the uterus, and sometimes that escapes and isn't able to be accounted for. So that's one of the challenges, I think.
That was the hard thing we learned by the mistakes of just putting it underneath there thinking it's not a big deal, and then you have to go, okay, before the fluid management you had to say, oh, I have this much and this is what's in the bag and we got this in the canister, and wait, I see about there's about maybe 100 on the floor.
All right, I would like to ask, how do you feel about setup?
Well, at my hospital, we're lucky enough that we use one room primarily that we do these procedures in, so most of the equipment is already in there.
So you don't have to waste any time searching for different pieces.
So we'll usually set it up. One of the extra circulator will set it up, during the previous case if we're not using it. Get all the canisters ready, all the tubing's hooked up, and that way we can just slide on into it when that case comes up. But it's nice.
I could use a fluid management system that would give me more accuracy, because you still have to look at, if I drop a whole 1,000 cc bag of fluid in a short period of time, then where's it going? And in a pressure bag, and you've got pressure on it, you cannot see how the fluid's coming down. You might think you have more or less than you actually do till you release the pressure.
What would your thoughts be if the fluid management system actually spoke?
Would that be fun?
If it actually said deficit's 500, deficit's 600, deficit.
And to let us know if the fluid bag was getting low, because it's in our rooms, it's kind of hard sometimes to visualize without moving or going to the other side of the room.
And the bags do hang low. The 3,000 cc bags hang very low. And I wish the pole went up a little bit more.
So we set a higher fluid management system, taller
To hang
and then it would speak.
Yeah.
Speak to us. That'd be great. So I think an improvement would be if you could figure out a way to get more fluid, that you wouldn't have to change your inflow and outflow so often. You wouldn't have to stop the procedure to change.
Because it's not just about the deficit, it's also about how quickly, and if you can catch that visually in a bag that's not in a pressure bag, you can catch it visibly on a screen that's saying, you just lost, you went from this to this.
I guess our procedures, we haven't had one where we've had to do a lot of fluids. I mean, the suction canisters are sufficient. But one thing I'm just thinking about that I haven't talked about is that we put a specimen sock, and it's just very easy to retrieve the specimen as well. So as I said earlier, we converted to the product offered by Hologic, and it's well designed to set up. Recognizing these procedures are very short, so you want to set up everything before the patient comes in the room. So I find just assembling, both as a scrub person or as a circulator nurse, they've dumbed it down. It's very easy. You press a button, it's prompting you what to do. One thing that at our institution we need to remember to do a little differently is to hang room temperature irrigation. I really like that you have an accurate accounting of the fluid, because that is so important in these kind of procedures.
Oh, yeah. It has increased satisfaction across the board. Our other management systems were so difficult and so cumbersome, and just they actually got covered up and pushed to a corner in the supply room. And then we went back to just pressure bags.